my name is Tarrie Carter. I'm going to give you a persuasive speech about breastfeeding. This speech is entitled, Is Breast Best? Why I chose this topic? I chose it for rather personal reasons. There's my son Camden that I had in January. Of course, with having a new baby, the topic came up, should I breastfeed or should I feed with formula? I did a lot of research, and that's where I came to my personal decision, breastfeed. What is formula? Formula is defined as a manufactured food designed and marketed for feeding babies and infants under 12 months of age. Usually this is prepared with the mix and water in a bottle. Indications for formula feeding would be mother's health. This could be because of a multitude of reasons, such as being infected with HIV or TB, which could be passed through the breast milk. If they have surgery on their breast, that takes away the ducts and the ability to produce breast milk. Or other instances, such as taking certain drugs that could be potentially harmful to the baby. There is the possibility of a baby being unable to breastfeed. An example of that would be cleft palate. They have to use a specially designed bottle to get formula. The baby is at risk for malnutrition, but with that being said, with consultation with the physician and everything, this could be improved with diet and medication. Absence of the mother. Clearly, if the mother is not there to supply breast milk for the child, then there is the opportunity of breastfeeding. Insufficient maternity leave or work interference with production. But with that being said, in 2010, Obama signed the Affordable Care Act, and what that says, it requires the employer to provide reasonable break time for an employee to express breast milk for her nursing child for 1 year up to 1 year after the child's birth, each time the employee has the need to express them. And then, of course, there's lactation insufficiency that affects about 2 to 5% of women. So, with that being said, we're going to move into health risks associated with formula. According to the World Health Organization and UNICEF, lack of breastfeeding and especially lack of exclusively breastfeeding during the first half year of life are important risk factors for infant childhood morbidity and mortality. With formula feeding, there's an increased risk of ear infections, gastroenteritis, severe lower respiratory tract infections, asthma, eczema, obesity, diabetes type 1 and 2, SIDS, and some studies have found an association between infant formula and lower cognitive development. Even less of a chance, but still risky, is Enterobacteria symphylae, I think that's how you say it. What that is with the use of powdered formula, it has been associated with serious illness and even death due to this infection, and also other microorganisms that could exist in the powder. This can be introduced by the production process. The World Health Organization believes that such infections are actually underreported. So, can anybody in here guess what is the average cost of formula?
About $25 to $30 a can.
Okay. Aside from sleep and time, the average 2 to 3 month old consumes approximately 30 ounces of either breast milk or formula per day. The average cost of formula is around 11 cents per ounce. So let's add this up. 30 times 0.11 equals $3.30 per day, and around $100 per month. And to think, this goes up with the child's age. Without accounting for the increase in ounce consumption, this alone is estimated at $1,204.50 a year for formula. Another thing that I'm going to incorporate in the speech is I'm going to have my sister come up, and for the remainder of the time, we're going to have her make a bottle of formula, and we're going to see how long it takes her. That's with sterilizing, putting it together, and putting it in the warmer.
I don't know.
Yeah. All right, will someone time how long it takes her?
Yep.
Okay, so while she's doing that, I'm going to talk about what breast milk is. What is breast milk? Breast milk is the feeding of babies and young children with milk from clearly a woman's breast. They can either do it directly or they can pump it. So we'll start off by talking about colostrum. That is the first type produced during the first days after childbirth. It's easy to digest. It has actually a laxative effect. This helps pass early stools and excretion of the stuff that causes jaundice in newborns, and it helps seal the infant's GI tract from foreign substances. Although the baby receives antibodies from the placenta, it actually introduces the newborn to immunoglobulin A that works to attack germs in the mucous membranes of the throat, lungs, and intestines. Foremilk and hindmilk. This is also a very interesting component of breast milk. Basically, the first part, the foremilk, has a lot of the minerals and nutrients that the baby needs. And if they keep feeding past it, then the body creates hindmilk, which has a lot more fattier components to help the baby feel full. So this is kind of lengthy. I found it on Facebook. This woman posted about 2 months ago about her child. She said, so y'all, this is just awesome. I read an article from a medical journal not too long ago about how mom's milk changes the tailor baby's needs in more ways than just caloric intake. So this doctor discusses that when a baby nurses, it creates a vacuum in which the infant saliva sneaks into the mother's nipple. There, it is believed that a mammary gland receptors interpret the baby's spit backwash for bacteria and virus, and if they detect something amiss, say like if the baby's fighting off an infection, mom's body will actually change the milk's immunological composition, tailoring it for the baby's particular pathogens by producing customized antibodies. Science backs this up. In a 2013 clinical and translational study found that when a baby is ill, the number of leukocytes in its mother's milk spikes. So this lady, long story short, realized one day that her infant was sick and she was pumping breast milk, and from one day to the other, she saw a change in her breast milk. And this is actually a picture of it.
Have you seen that in your own baby?
I have. My son just recently came down with an upper respiratory infection, and our milk changed to a more yellower color. Health benefits for breastfeeding for the baby. It's estimated that more than 1 million deaths of babies could be prevented globally per year through the more widespread of breastfeeding. Again, like I said, decreases respiratory tract infections, diarrhea, asthma, food allergies, celiac disease, diabetes, and leukemia. It also has been proven to improve cognitive development and risk of obesity in childhood or adulthood. With that being said, not only is there benefits for baby, there's benefits for mom. Short-term benefits include less blood loss post-delivery, better shrinkage of the uterus, weight loss, less likely to suffer from the effects of postpartum depression, and decrease infertility post-baby. Long-term benefits decrease risk of breast cancer, heart disease, and rheumatoid arthritis. Also, let's reiterate the fact that it's a lot cheaper than formula. In closing, Despite recommendations that babies should be exclusively breastfed for the first 6 months, less than 40% of infants below this age are exclusively breastfed worldwide. And according to leading organizations such as the WHO, CDC, and Human Services are attempting to reduce the use of infant formula and increase the prevalence of breastfeeding from birth through 12 to 24 months of age through public awareness campaigns. So, indeed, breast is best. You can make a difference in your personal life and that of your child by choosing to breastfeed. Any questions, concerns, or comments? And with that being said, my sister is still making formula. So. Thank you for your time.
Be sure you get the thrusting on
Yeah.
camera too. Leave that there.